Assessment of reduction. If exposure at three sites has not been performed, the orbital margins are the areas that should be palpated first to determine reduction. If reduction has been satisfactory, these margins will be smooth and continuous. This finding by itself, however, is inadequate verification. Although the zygomatico-frontal suture area provides the strongest pillar of zygoma, it is one of the worst indicators of proper reduction of the entire complex, even when surgically exposed and evaluated directly. This we need to understand that only the frontozygomatic suture reduction doesn't indicate that the zygomatic complex fracture has been totally reduced. It might be that again there might be any kind of discrepancy at the buttress region or at the arch region. One should also palpate the mastoid vestibule. If there is any flatness still visible, then zygoma has not been properly elevated. If there is any doubt about proper reduction, exposure is mandatory. In this case, an incision in the mastoid vestibule offers excellent exposure of the zygomatico-maxillary buttress and the infraorbital rim. Temporary support, mostly indicated as a supplementary measure under the following circumstances: when the zygomatic complex is unstable following reduction, when there is gross combination of the zygomatic bone, when there is combination without bone loss of the orbital floor. The instability following adequate reduction could be due to rupture of the enveloping periosteum or attached temporal fascia. So in these situations, we need to go ahead with a temporary support of the reduced zygomatic bone. Concept which is primarily based on the introduction of a pack or other material into the antrum so as to exert a counter pressure against those forces which tend to bring about a relapse of the position achieved by indirect reduction. Since the pack will bring about repositioning of the fragments by pressure from their antral aspect, it will be evident that this selective effect can only take place if there is absolute stability of the remainder of antrum and the other elements of the zygomatic complex.